Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan, and today I will be discussing an editorial on the future of arthroscopy and sports medicine that has been seen in the Journal of Arthroscopic Surgery and Sports Medicine, which is published by Scientific Scholar. Now, this article puts light on the sports-related injuries and various modalities for treating joint injuries and also promoting faster recoveries for sports people. So, to talk to us on this, we have the author who's written this editorial, Dr. Raju Vaishya from the Department of Orthopedics, Indraprastha Apollo Hospital, New Delhi, India. So, welcome to Medical Dialogue, sir. It's really a pleasure to be interviewing you here today.
Thank you very much. It's my pleasure.
Great. Now, sir, as we're talking about the future of arthroscopy and also the relation with sports medicine, now the subject of sports medicine and healthcare facilities for athletes and sports persons have all emerged as a specialty field in the recent years, owing to various big commercial events like the IPL, which just got over. So, if you could just share your views about the same, what is your say on it?
Absolutely. The growing popularity of major sporting events like IPL has put a spotlight on the importance of athlete health and performance. This has led to a surge in demand for specialized sports medicine facilities and healthcare professionals. Sports medicine goes beyond treating injuries, it also focuses on prevention, rehabilitation, and optimizing athletic performance.
Yes, definitely, sir. Keeping in view the big commercial events that are happening now, our country hosts several national and international sports, as I mentioned, like the IPL or even the PKL, ISL, and many more that go on throughout the year. So, how arthroscopic surgeries and related healthcare they all hold significance in the light of the same, and how journals like the one that we're just speaking on, like the JASSM, play a role in this regard.
National and international sporting events like IPL, PKL, and ISL showcase athletes pushing their bodies to the limit. This inevitably leads to injuries and fatigue, and arthroscopic surgeries offer minimally invasive techniques for faster recovery and quicker return to play. The journals like Journal of Arthroscopic and Sports Medicine or JASSM play a crucial role by disseminating the latest research on these techniques, thus improving the outcomes for athletes and overall helping the elite athletes and players who are involved in these injuries.
Great. Yes, definitely, sir. Now, as the editor, as you've written the editorial of this journal that caters to such a unique clinical specialty which stands on the interface of sports and medicine, how you see the specialty going forward and what type of research the field needs and the journal that intends to publish. So, what is your say on it?
See, the future of sports medicine is very exciting. We can expect advancement in areas like personalized medicine, gene editing for injury prevention, and use of wearable technology for real time monitoring. I will further expand this. Gene editing can identify the genes in a particular athlete and can tell us in advance if they are prone for certain injuries in certain sports. And hence, either we can prevent these injuries by wearing braces, doing rehab exercises, and so on. And so, also, once a player is injured, we do not know how he is doing and what problems he may be facing. And hence, wearable technology like smartphones or smart watches can help physicians to monitor their progress in real time, and they need not to visit the doctors or surgeons all the times. And JASSM will focus on publishing such high quality research on these topics, along with studies on optimizing nutrition, mental health, and recovery protocols for athletes that are equally important as their surgical treatment.
Yes, very correctly mentioned. Now, lastly, sir, as a practicing clinician and also the journal editor, what will be your message to NMC with regard to support the Indian journals catering to such subjects and also towards the Indian medical publishing fraternity overall?
As a clinician and editor, I urge the National Medical Commission of India to actively support Indian journals like JASSM. My message and request to NMC authorities is that India must have its own indexing portal and should not give recognition to genuine journal and should give recognition to genuine Indian journals associated with medical societies, institutes, and association of India via their own evaluation system. This, I believe, will help Indian journals to become more competitive internationally and NMC recognized before they go for foreign indexing portals. Because going directly to foreign indexing portal nowadays is very challenging, and often there may be a bias to have rejection from journals from lower middle income countries, and hence having your own indexing portals can substantially help Indian research and Indian journals. Furthermore, more financial grants uh, are to be made available for open accessing publication, which helps the readers to access the journals and articles and also to the global audience, and hence Indian research can be more visible, more downloaded, and more cited in future, overall improving uh, the research metrics of Indian authors. Lastly, I would say that a due recognition and incentives for Indian researchers must be made by Indian government who are publishing in national journals along with international journals. This will encourage Indian medical professionals to contribute to the growth of domestic medical literature, and we can actually promote uh, low cost inventions which are applicable to our population, and that may be cost effective rather than relying on research and using the output of that research in our Indian context, which may be quite expensive or inaccessible to most of our patients and athletes.
Yes, very true said, very truly said, sir. Definitely, it's a plea that it should be taken forward so that more and more people get to publish, and awareness is definitely created regarding sports-related injuries or to the practicing clinicians, so that they are equally aware about it and they catch it at the early stage. Definitely. So, thank you so much, Dr. Raju Vaishya, for all our valuable insights and joining us today at Medical Dialogues and giving all your insights into us.
Thank you, Dr. Nandita, for exploring these questions, which highlights the problem and the solutions that may be required for Indian research and Indian journals as well. Thank you very much.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.